Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's discuss about preventive medicine services and the coding guidelines, and we'll see a few practice questions for your better understanding. So let's start. So first let's understand what is preventive care and what is diagnostic care. Since we are discussing about preventive care services, we should have a good understanding on preventive services. Okay, what is preventive test? So preventive tests are screenings which are performed to detect the disease or condition before any symptoms appear and helping you to identify the potential health issues in an early stage. Okay, so we have to take this preventive test at least once in a year so that we can avoid many kind of severe medical conditions. So for example, by taking mammogram, we will able to get to know that we have a breast cancer or not, and same way taking colonoscopy and all of other like diabetes testings. Okay, and many other tests are there, and routine vaccination is important. Okay, so all of these kind of preventive actions that we have to take in order to avoid any kind of severe medical conditions in future. Okay, so that is the meaning of preventive test. So here example you can see colorectal cancer screening. Example colonoscopy. A colonoscopy is a preventive screening test used to detect early signs of colorectal cancer in an individual at an average risk, typically starting at age 45 or older. It helps to find the polyps or abnormal growth before they develop into cancer. Okay, so this is called preventive test. And coming to diagnostic tests are conducted to investigate and confirm the presence of condition after the symptoms have developed or to further understand an existing problem. So diagnostic is like already the symptoms are started. Okay, now the patient has to take some kind of treatment in order to cure the problem or in order to investigate that problem is really exist or not. So example, same colonoscopy, if you see, if patient has a symptom such as blood in stool, an unexplained weight loss, or persistent abdominal pain, diagnostic colonoscopy may be performed to examine the colon more closely and determine underlying cause such as cancer or other gastrointestinal issue. Okay, here maybe patient might have already developed colon cancer. We don't know that. So after doing the diagnostics test, if they confirm, then they will order for routine checkups. Okay, so the chart goes like this. If we follow preventive test, if we take proper preventive checkups, then we may not get any kind of cancer, or like if you take pap smear or if you take mammogram on time, so we will avoid such severe medical condition in future. So preventive medicine is all about taking preventive test at least once in a year. So what it will do? So it will promote our better lifestyle. Okay, like the quality of life and also longer lifespan, and again detection of illness in early stages. So it will keep you fit and active. And say for example you got to know that is you are pre-diabetic, so you can at least take action and you can start reversing it, right? So that is why preventive services are very important, preventive tests are important. So let's see the guidelines. So as I said earlier, preventive medicine services focus on evaluation and management of an individual health to prevent the illness or injury, and it is designed to promote health, identify risk factor, and provide early interventions. And again, annual physical exam for infants, children, adolescents, and adults. So we have codes for infants, children, adolescents, and adults, and this preventive services works, or the code varies based on the patient age. And again, if you see here, the comprehensive services include, the services can include age and gender appropriate history and physical exam. So here age is important as well gender appropriate. It means say for example for mammogram, okay, mammogram will be performed on female patient, and same way pap smear. Okay, so that is called gender appropriate history and physical exam. Next, counseling on health risk, lifestyle, diet, exercise, review of immunization and screening test, risk factor reduction and intervention. So all of this will be included in the preventive services. What is excluded then? Diagnostic services like lab test, immunizations, okay, and many other which can be billed separately. Okay, all of the other services, diagnostic services will be excluded from preventive. So if we are provider is performing both preventive service and immunization, we will code separately. We will bill one code for preventive and we bill one code for immunization. Okay, with using appropriate modifier. We'll see the further guidelines. So now coming to the coding guidelines we have for preventive services. So the first thing that we have to check is type of preventive medicine services. So there are two types, like it is not like a type, but it's like more into the patient is new or established. Okay, so new patient and established patient. We have separate code set for new patient and we have separate code for established patient. But if you see, new patient codes are called as initial comprehensive preventive medicine evaluation and management, whereas established patient is considered as periodic comprehensive preventive medicine re-evaluation and management. Okay, so this is the initial EandM service, whereas periodic comprehensive will be the follow-up. Okay, so already patient has taken the preventive service and now again regularly the patient is being re-evaluated. So then we will be coding for established patient. And then what we have to check? We have to check patient age. Okay, these are the codes are age specific, whether this patient is infant or adolescent or adult. We have to check and we have to code it accordingly. And use preventive codes only. So when we will code only preventive service, when the visit is focused solely on preventive care. So they have to specify that the chief complaint should be stating that patient came for physical exam, patient came for a preventive service. Okay, so like the chief complaint should not be any acute condition or any kind of chronic condition. The chief complaint should not be like patient came for abdominal pain or patient came for chest pain or anything like it. Particularly the chief complaint should be regarding physical exam. Okay, then only we are supposed to code preventive codes. Next, a modifier 25 usage. Here it is important. Add modifier 25 to the problem oriented EandM code if significant and separately identifiable issue is addressed. Okay, so for example, you are taking a physical examination in the particular visit. While doing the examination, provider may identify or the patient may express herself or himself that he is having some kind of problem. Okay, so which is again the other problem, acute problem needs one more evaluation and management. If patient is saying I am having a persistent cough or I'm having a upper respiratory infection, some other kind of acute problems, any other problem other than preventive services, if it is being addressed at the visit, if it needs a significant separately identifiable EandM service, then we are supposed to use two EandM codes. Okay, one is to provide preventive EandM, one we will use, and with that accordingly office outpatient EandM also we can utilize, and we will use 25 modifier. And while giving 25 modifier between these two EandM, make sure we have to give the 25 modifier with the office or outpatient EandM only, not with the preventive service. Next, additional billing. Additional billing, as I said, with the preventive service, any other diagnostic services. Okay, if they are performing pap smear or if they are performing, other like vaccines. Okay, then what we will do? We will build the vaccine code and we will use the 25 modifier to distinguish between, or like as it is a separately identifiable service, we will use the 25 modifier with the preventive medicine. Okay. And next, counseling and anticipatory guidance. It is included, actually it is included in the preventive service, but if an individual needs extra interventions, okay, so if it goes with an individual based, we are having the different set of codes 99401 to 429. So this, from this area we can utilize the EandM codes. So overall coding guidelines, The important things are, we have to first check whether this patient is new or established, and patient age, and again like when to use only preventive service and modifier 25 usage. Okay, so these are the things, and additional billing also is important. So we will see the code set and we will be able to understand it in better. So let's see the CPT codes. So you can see here new patient codes and established codes. So new patient codes are initial comprehensive visit, establishes periodic re-evaluation. Okay, so firstly you can see 99381 to 387, these set of codes we have for new patient. So if you see infant younger than 1 year, 99381, and whereas adult or 40 to 64 year, okay, if you are getting 55 year, you should assign 99386. Okay, and same way coming to establish, here also infant younger than 1 year, so patient age is 10 month, we will be assigning 99391 if patient is established. Same way senior, say for example patient is 70-year-old patient, came for re-evaluation, so 99397 we have to bill since the patient is senior, okay, above 65 year. And see the complete code description, 99381 and 391. 381 is an initial comprehensive preventive medicine. It includes evaluation and management of individual, including an age and gender appropriate history, examination, counseling, anticipatory guidance, risk factor reduction interventions, and ordering of laboratory and diagnostic procedure, new patient. Okay, and infant age younger than 1 year. So rest all of the other codes will vary in only age. Okay, and same way established patient, periodic comprehensive preventive medicine, re-evaluation and management of an individual, including an age, gender appropriate history, examination, counseling, anticipatory guidance, risk factor reduction, interventions, and ordering of laboratory diagnostic procedure, establish patient, infant age younger than 1 year, and remaining all of these codes vary based on the age. Okay, so the age, we will have the age range. Okay, the group, say for example 12 to 17 year, one code. Same way 18 to 39 year, we use one code. Okay, so if you are getting any age in between, you have to check that the particular age comes in which range, and you have to select the CPT code. Okay, so if you are getting 30-year-old established patient, then you should select in this range 18 to 39 year. So you will select 99395. Okay, easy. So see here, now we'll see the ICD codes. So whenever we are billing for preventive medicine, ICD plays a very important role. Okay, so if you see this, all of this encounter health examinations, so these are first listed ICD codes. Okay, we will bill this ICD as a primary diagnosis. So and also these ICDs are age specific. Okay, so that is why it is important, whenever we are billing for a preventive, we have to check the patient age both for CPT as well ICD. Okay, so new patient 0 to 11 months, that is younger than 1 year. If you see 99381, we have almost 4 codes. Okay, so 4 codes, in that Z double zero and 110, health examination of newborn under 8 days old. So when patient is the baby, like it is less than 8 days, under 8 days, so we will code G double 110. And if the patient is newborn 8 to 28 days old, okay, somewhere between 8 days to 28 days, we have to use G double 111. And next, routine child. Okay, other than, like more than 28 days, patient is maybe 5 months old or patient is 10 month old, then what we have to use, you can check, we have two different codes. G double 121 is for encounter of routine child health examination with abnormal findings. So In the particular encounter, if the provider finds any abnormal findings, we have to go with the abnormal code. Okay, Z00121 we have to bill. And same way G00129, encounter of routine child health examination without abnormal findings. So after evaluation, if provider did not find any abnormal findings, we have to go with G00129. Okay, and same other two codes applies up to 17 years. Okay, up to 17 years you can utilize same G codes. You have to check abnormal findings are there or not. Accordingly you can bill the ICD. And last, after 18, okay, if patient is 19-year-old, patient is 20-year-old, and patient is exactly 18-year-old, then we have a two different set of codes, ICD codes. G0000, encounter for general adult medical examination without abnormal findings. Okay, patient age is 35 years and upon examination they did not find any abnormalities. Then you have to go with G0000 and 35 year means you will go 99385. Okay, and same way G0001 is encounter for general adult medical examination with abnormal findings. So patient age is 45 years and upon examination they found some abnormalities. So 45 year 99386, and again you have to, as the patient is having abnormality, you have to use G00 and 01. Okay, so this is important, and same ICDs are applicable for established patient also. So all we have to check is what is the patient age, and after that we have to check whether this patient is having any abnormal findings or not. Okay, based on that we will assign the ICD code, and remember these ICD codes are first listed ICD codes. We will be sequencing these ICDs first, primary diagnosis. Okay. So same thing I have added for established patient also. So established patient, as I said, it starts from 9939 series up to 99397. So ICDs remain same for the particular age criteria. Please check and code it accordingly. Next we will see the, so now we will see the practice question. Like I'll just answer the question. So later you may pause the screen or you can just go back to the codes and you can try to take on your own as well. So here 35-year-old female schedules her first visit with a new provider for a comprehensive preventive checkup. Okay, so it's a comprehensive preventive. So we have to go with the new patient codes. And she has no significant medical complaint and no prior history with the provider or any provider in the group practice. During the visit, the provider conducted detailed review of her medical, family, social history, performed physical exam, and counsel her for maintaining her healthy lifestyle. Okay, so here all you have to check is 35-year-old. Patient is 35-year-old. Okay, and it's a comprehensive preventive. Initial visit, so new patient. Okay, so answer should be 99385. Okay, you can just go back and check the age criteria. 99385 would be 18 to 39 year. Up to 39 year you can code 99385. So answer is 99385. So we'll see next question. So here a 12-year-old child comes for a preventive follow-up. During the visit, provider conducted the counseling. Child receives the Tdap vaccine administration. What code should the provider report? So check the patient age. Patient is 12 years. Okay, and patient came for preventive follow-up. That means you have to go with the establish. During the visit, provider conducted counseling and child receives the Tdap. Okay, Tdap vaccine. So Tdap vaccine is separately billable service. Okay, we have a separate code and we have to bill that accordingly. And see the options 99393 99. Okay, all 393 is correct for the 12-year-old patient. With that, what you have to check? The Tdap service. Okay, so TDAP service, as you know, the vaccine concept, two admin codes will be there, 90460 and 90471. Okay, one is 460 when we will use when patient age is less than 18 with counseling. Counseling should be there, so we can use 99460. If counseling is not there or patient age is more than 18 year, 19 year, 20 year, then we go with 90471. Okay, and also if patient age is less than 18 but there is no counseling or there is a provider did not administer the vaccine, then we have to go with 90471 as our administration code. So here TDAP vaccine, single vaccine, so we have to use one admin code. So since provider conducted counseling, answer is 90460. Okay, admin code. And for the product, TDAP is a vaccine. So for vaccine also we have to build that particular TDAP vaccine code. And for TDAP, you have to be very careful with the age. Okay, we have two codes for TDAP. One is less than 7 year and one is older than 7 year. So older than 7, here patient is 12 year. So for 12 year, we have to go with 90715. Okay, 90715 is a correct answer for TDAP. So overall, if you see, the answer is CPT is 99393 for preventive and 90460 is for our administration code for vaccine and 90715 is TDAP vaccine code. Okay, so 25 modifier is important and we are using with the preventive service ENM code since we have a separately identifiable services performed on the same day. Okay, so this is important here. Answer is C. Okay, I hope you have understood this particular question. So if you have any queries, please do comment. And lastly, we'll see one more question. So see this question. 45-year-old established female visit the clinic for her annual preventive checkup. During the visit, she mentions that she experiencing occasional chest pain. The provider performs a detailed evaluation of her chest pain and provides a low MDM service. What CPT codes and the diagnosis should the provider report? So if you see here, the chief complaint is regarding annual preventive checkup. Okay, and patient age is 45 year, patient is established. Okay, we have to go with the established preventive sets and patient age is 45. But what happens after that? She said that she is occasionally feeling chest pain. So provider performs a detailed evaluation of her chest pain. So like it goes with the one more ENM service. Okay, since the provider is spending the time for the evaluation and management, we have to use the office or outpatient ENM here. So the provider also documented he has performed low medical decision making service. Okay, so here if you see the options. Option A only CPT. Okay, only preventive and ICD is there and it is wrong. Only ENM code, evaluation and management is there. Again, you cannot code this. And C and D, if you refer, 99393. Okay, 99393 is not the right answer. 993 because the age is important. 393 is not the 45-year-old. Okay, and 396. Okay, between C and D you have to check. Okay, so let's see the chart of the codes so that you will easily can take the codes based on age. And apart from that, focus on ICD here. Okay, so if you see patient is having chest pain. Okay, so if you ask yourself, in this particular encounter, do we have any abnormalities or not? Patient have abnormalities. Okay, so provider found abnormality. And again, the additional ENM service is performed. Okay, so we have to check the rationale so that I'll answer it. So see the charts. Okay, so I already gave a clue that patient said that patient is having chest pain, and upon saying that, provider did one more E&M service. One more E&M service is nothing but a separate service for the chest pain. Okay, additional service you can consider. So patient age is 45 year, established. So 45 year established, patient code is 99396. Okay, and then if you come to ICD, what is the ICD? We have to go with G0001 because patient had an abnormal findings. Okay, so answer G0001 and the diagnosis. Coming to E&M, patient is established patient and also provider performed low MDM. Okay, low MDM 99213. So 99213. So if you see, the total answer is, final answer I have given 99396 is for preventive service, established, patient age is 45 year, and 99213 is for low medical decision making, and 25 we are using according to our coding guideline. Whenever we are billing this two E&M service, we will use 25 modifier with our office or outpatient E&M code. Okay, this is the right sequencing. And then G0001 we have used because we found the abnormal findings. And lastly, R07.9 we have used because patient is also suffering from chest pain. Since the chest pain is being addressed in the encounter, you cannot ignore the chest pain here. Along with the G0001, you also have to code the chest pain code. Okay, since chest pain was not being unspecified, you can go with the unspecified chest pain code. And while sequencing, as I said, the G0001 you will sequence first, and secondary you can sequence the chest pain. Okay, so yes, that's all guys. I think I have made a I covered all the guidelines regarding preventive service. So it is very important for your CPC exam, and if you ask the people who wrote in exam in 2024, they have got the question regarding preventive service. So please do not ignore this particular service. And whatever I have explained, just take a note and go back and refer in the book, so you will have a clear understanding. Okay, do not lose any marks on preventive service because it is very easy service. And the CPC preparation batch starting from January 16. So many are asking me like when you will start. So as many of you asked, I'm starting one more batch. Okay, a new batch. So please, if you are interested, you can reach me on WhatsApp. Okay, that's all guys. Thank you for watching. If you have find it useful and if you have understood, please do share with your medical coding friends, and also please do subscribe to my channel. And if you support well, I can definitely create more videos, and if I don't get views, definitely I cannot. With this time constrictions, I do not feel like I have to put effort. So please, yeah, thank you all. Thank you.